So can you explain how a patient with medical conditions such as chronic pain may be impacted mentally and emotionally, and how this psychological impact may differ from someone without these type of medical issues?
Yes. So one of the things we see as pain psychologists, and one of the things I've seen, is when someone's struggling with a persistent pain, a persistent chronic health issue, it can lead to depression or anxiety or frustration or stress. And oftentimes the depression is solely triggered by the medical condition. Whereas outside of the pain management world, you may have someone who struggles with depression or anxiety for a variety of other factors. And oftentimes when treating someone who has a chronic condition, such as chronic pain, their hope is once we resolve the pain issue, then the depression and the anxiety or any other mental health issue will go away. And we do see that. Unfortunately, we have to get to the point where we can resolve the pain issue to help that emotional distress resolve.
And so then, Emilia, can pain have different influences on mental health based on its cause? For example, can the pain caused by a serious car accident have a different effect on a patient compared to pain caused by a sports injury that did not result from a traumatic incident?
Oh, absolutely. So I think in your question, you mentioned traumatic incident. And if we took the same example of a traumatic incident for one person versus a second person, it may not impact them the same way, depending on their support, the level of support they have, their understanding of what occurred, what their thoughts were about what happened. So I think that there can be, for the person that does develop potentially like a trauma disorder related to the incident, that's going to fuel their persistent pain condition. It's going to keep their nervous system at a more heightened state. So it does make it more challenging to address the physical pain aspect. So that's why, we have pain psychologists that we can dive into that and really help the patients make those connections in order to get better. And I'd like to add also, if we think of somebody that's very isolated, we can see how they can have a worse, prognosis. Maybe they're blaming themselves, or as Dr. Fitz mentioned, depression. There could be more mental health symptoms that start to be a part of the picture.
Please explain the role of a pain management psychologist in a multidisciplinary team.
So as a pain psychologist in a multidisciplinary team, sometimes our role is a little complicated in that a lot of us who get trained as psychologists learn about depression, anxiety, psychological conditions. We don't always learn about medical conditions as extensively. And so one of the beauties of being a pain psychologist, in my opinion, is we have the opportunity to marry the two, so to speak, to understand how the psychological issues can affect the medical issues can affect the psychology issues, and to try and work on both so that people can have better outcomes.
What is the advantage of having a pain management psychologist on a team as opposed to a general psychotherapist?
Well, we have the ability to, as we're thinking of the biopsychosocial model, we're looking at the whole individual, and we're looking at the big picture. We're helping the patient or client really understand how all of this is impacting them. And we're also empowering them to think about, well, okay, I have a better understanding what's going on with me, but how can I get better? So, we have access to a lot of wonderful research that shows, what are the best interventions for helping people. And so I think that's something that I've noticed in my work over the years, that people are grateful to be guided in that direction in terms of where to put my focus as a patient. How can I get better versus spinning my wheels, working on something that's just going to maybe exacerbate my mood symptoms and make things more challenging.
Okay, Dr. Fitz. What are some current mental health tools or modalities used to help patients who are living with pain?
So in terms of mental health tools, as a provider, we use CBT or cognitive behavioral therapy. We also use ACT, acceptance and commitment theory. We may use biofeedback. We may use mindfulness, meditation. There are a lot of tools that are non-medication that can be useful in pain management and helping people feel better.
So, what implications does a patient's culture have on pain management approaches and treatment outcomes?
So when we think about a patient's culture, we have to think about, who is this person, their upbringing, their values, their goals in life. And so we want to really get to know that person to understand their view of life and their view for themselves as well. What is possible? What makes sense to them? And so in knowing that, then we can help tailor the treatment plan and help them really accept and work on interventions that fit well with their, with their worldview, I guess you could say. But I think just being very sensitive to that, in our clinic, we have patients from all over the world that are new immigrants to people that have been here a long time, many generations. But even then, they may be from a particular culture or all the other different factors that we think about: gender, language, socioeconomic status, their understanding of medical care. Because again, we could have somebody that's college educated that just doesn't think about or doesn't buy into the mind-body connection, and they really want to just look at their pain from a physical perspective. So that's a little bit more challenging. But knowing where they are and working with that is the best place to start.
Why might some patients be apprehensive about working with medical professionals regarding their pain management?
So when we were just talking about the biological model of, hey, I want to fix this, and if I can fix it, I should be able to, because the viewpoint that I go to a doctor, I get a treatment, and everything goes away. I've had lots of clients over the years who say, well, my family members just tell me take more medication if I don't feel well. Because a lot of us take medication if we don't feel well. So the idea that you take more seems like it might work. It doesn't work. We're not recommending that. But sometimes that's what people think. And the hesitancy to work with different providers may come out of a mistrust of the medical community or the medical system. If you have a family member who had a horrible experience or negative experience, if you've been a patient who's had pain for years and you felt unheard or not valued, your perspective wasn't listened to, you may not want to see a new provider. You may not want to open up again. So it really behooves us as providers to always be open and compassionate and do our best to be there for the patient in the way they need.
What can clinicians do to make patients more comfortable with working with them to manage and treat their pain conditions?
Well, I think it starts with listening to them. Also, from a clinician's perspective, realizing that you're conveying a lot with the nonverbals along with your language, of course. So listening, having respect for the individual, the fact that they're opening up to a complete stranger and maybe having to discuss, traumatic events or things that are very painful to them. So I think that that's a huge step in establishing rapport. And also, patients come to our clinics looking for help, and they may have a little apprehension in speaking with the pain psychologist. But I think, if you're genuine, it does, people pick up on that if you want to help them. And it's not easy, because some people, again, if they've had negative experiences in the past, there's a level of defensiveness we all have those interactions. And so we hope that they come back when they're at a place where they can revisit or start the conversation again. And so I think that that's important to think about where the individual is, because we can't, it's not like we're going to convince them of something, but we're trying to guide them in a certain direction. And of course, provide evidence-based treatment and be on their team.